Hospitals across the country, we're told now, are struggling to cope for elective surgery numbers. Now, if you're waiting for elective surgery, I know exactly how you would feel. I've heard some horrendous stories, people who need knees and hips and all sorts of elective surgery. By the middle of this year, it's predicted that up to 500,000 of us will be on an elective surgery waiting list. There's calls for states and territories. They've got to lean on the private hospital sector and say, come on, open up some resources, we need your help. Joining me now is Jane Griffiths, CEO of Day Hospitals Australia. Calls for private hospital sector to outsource public patients using day hospitals. Good idea?
Hi, Steve. Thanks for giving me the opportunity. Absolutely. As you correctly said, the waiting lists are growing and expanding rapidly. And it's not only the people that are actually on the surgical list, it's patients that have been referred into the public sector but still haven't had an appointment with a specialist. So it's actually larger than the governments are telling us. The day hospital sector is a very efficient, cost-effective place to have many procedures that are on the waiting list. For example, in New South Wales, there are 24,000 people waiting just for cataract surgery. And as you can imagine, that waiting time impacts their daily life. They could be driving a car, which they shouldn't be doing, which endangers others. So there are all sorts of ramifications for people waiting on these lists, experiencing extreme pain and disability for their usual daily activities. In Victoria, because Victoria had so many lockdowns and cessation of elective surgery, they have over 200,000 patients waiting for surgery. This is an extraordinary number. In New South Wales, it's around 150,000. So these larger states really do need to start using every opportunity in the private sector. So that does include the day hospital sector. I have to say that many jurisdictions have started to use some day hospitals, but it needs to be expanded. It's not happening enough. Whereas other governments, particularly in Western Australia, are not using the sector at all, which just doesn't make any sense at all, particularly for procedures like cataract surgery, endoscopy, diagnostic endoscopy, which is really important, ENT surgery for young children. If young children requiring grommet surgery, for example, have to wait long periods of time, this will affect their speech and their learning because they can't hear properly. So those sorts of procedures can be done very effectively and very efficiently in the day hospital sector.
And what do you hear from the operators of the public health system? Would they be happy to let that overload move to areas that are currently underused?
In some cases, but it's more the departments of health that we have discussions with.
The bureaucrats, of course.
Yeah. There are, sections in the departments of health that actually outsource and purchase private services. Now, in some states, they're well established. In Queensland, they have an organisation called Surgery Connect, and that's actually been running long before COVID, and they have outsourced to the day hospital sector, particularly for ophthalmology, eye procedures and others. But as a result of COVID, many states have now looked at setting up this sort of panel to outsource procedures to the sector, and so they invite the private sector to tender for those services.
Yeah, well, the interesting thing is we call it elective surgery, Jane, but often it's not elective, it's necessary, right?
Absolutely. The term is not a good one. It's necessary surgery, as you say, and it's not a choice for the patient. They really do need this surgery to improve their quality of life.
Jane Griffiths, nice to catch up with you. Thanks a lot for your help.
Thank you so much.
Elective surgery, we really need to sort that out.